Blisters around the mouth, hands, and feet. Sound familiar? Hand-foot-mouth disease is a common viral infection affecting kids of all ages year-round. If your child's been diagnosed with hand-foot-mouth, here we're going to talk about what you can expect in the course of this illness and how it presents, how it spreads, and how you can best care for your little ones. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered approach to solve their children's health issues. So if that sounds like you, please make sure to subscribe to the channel for more content just like this. This video is all about getting you up to speed on this common childhood disease known as hand-foot-mouth and how to help your little ones. Hand-foot-mouth is a viral illness caused by enteroviruses and Coxsackie viruses that gets its name from the skin blisters that can be seen on the hands, the feet, and mouth, therefore hand-foot-mouth. The rash itself is not contagious, but the virus spreads easily from one person to another through either respiratory droplets or fecal oral contamination. In households, hand-foot-mouth has up to 80% transmission rate. The presentation. Now, hand-foot-mouth typically presents at first with a mild fever, sore throat, runny nose, loss of appetite, and stomach ache. So at first, it looks like a common cold, but after a few days of these initial symptoms, you will see some mouth sores, maybe raised blisters around the mouth and on the palms and of the hands and feet. Sometimes you can even see red bumps on other parts of the body, like the buttocks, the diaper region, knees, and elbows. These blisters and rash are usually described as uncomfortable, mildly itchy, raised, but they are not painful or burning in nature. And it can be differentiated from other vesicular rash like chickenpox blisters, and that hand-foot-mouth disease blisters don't scab and they don't crust over like blisters from chickenpox. Transmission. Now, hand-foot-mouth is transmitted via airborne respiratory droplets and through fecal oral contact. While children with hand-foot-mouth is most contagious, in the first week of the illness, there is still going to be ongoing viral shedding in stools for up to 2 weeks after the first onset of symptoms. So to prevent transmission and spreading of the illness, take careful measures to wash your hands thoroughly with soap and to minimize that fecal oral transmission and also covering up your coughs. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified of future content just like this. Treatments. For most children with a healthy immune system, hand-foot-mouth is a self-limited illness and resolves on its own without medications. And also, because it is a viral illness, antibiotics are not going to be effective in treating the illness here. Treatment and care for hand-foot-mouth is therefore mostly comfort care, which means reducing the symptoms of discomfort, such as having a sore throat, fever, and minimizing the risk for dehydration. So making sure your child is drinking fluids to stay hydrated is key, such as in offering small sips of water or clear liquids. And for pain and fever, Motrin and Tylenol can offer temporary relief. And one note is that when a child is feeling pretty terrible with a fever or pain, they will be less willing to cooperate and drink that fluid or to eat. So by treating their pain and fever, you will definitely have a more cooperative child when it comes to getting them to drink fluids. In 5 to 7 days, your child will start to recover and feel better. And you can tell this by the return of their appetite and their interest in drinking more fluid. Your child can return to school once that oral lesions are all gone, which is usually about 5 to 7 days. And oftentimes, they will still have a rash on their hands and feet. You don't have to wait till the rash is completely gone to return to school because, again, remember, the rash itself is not contagious on its own. Now, what about the rash? Well, the rash will dissipate over 7 to 14 days, and you don't need to apply medicated creams for the rash. Just simply moisturize the skin as you normally do. And if your child is experiencing itchiness from the rash, I like this particular cream by CeraVe. One common phenomenon that appears on the nails about 2 to 4 weeks after having hand-foot-mouth disease is nail peeling. It can happen in the fingernails, and I've seen it in the toenails. Though it looks awful, it usually isn't painful, and don't worry, the nails will grow back. The information on this channel is meant to inform and not to replace in-person medical care and diagnosis. Now, there are other illnesses that can mimic hand-foot-mouth disease, and if you believe your child has been ill for over 5 days or is experiencing severe symptoms of fatigue, fever, or dehydration, please be advised to seek timely medical care. And in summary, if your child has hand-foot-mouth, it is, for the most part, brief and self-resolving within 2 weeks of time. The virus causes a sore throat and uncomfortable rash. And the key to caring for your child is comfort care and pain management and ensuring that they are staying hydrated during the illness. In our Las Vegas-based practice, we work with families one-on-one, offering concierge individualized care to each patient holistically, minimizing unnecessary pharmaceuticals and treating the root cause. To learn more about how you can work with us, click on Become a Member and fill out the information so that we can schedule a time to chat. Thank you all for watching, and see you next time as we navigate the world of holistic pediatrics.